emergency physician lead for Northam Health Service, but I'm also the Director of Clinical Training here. I'm mostly based in Northam, but I do sort of travel around Wheatbelt, delivering education and connecting with clinicians. I grew up in the far eastern Wheatbelt. I do live in Perth. I travel up to Northam. It's quieter and more peaceful, and I can actually hear myself think. There's so much less chaos, and you can spend so much more time with patients, and that you know everybody's name, and you know the junior doctor's name, and you know the names of the doctors that you're working with, and you know the names of the people that are working on the ward and elsewhere in the hospital.
I've been working here since 2017 and it's been ongoing and on a regular basis since then. Initially when I came in, I thought it was a one-off thing, so I came here for a few shifts in both ED and the ward. Coming from a diverse medical background where I did multiple specialty training in ICU, ED, general medicine and anesthetics in the past. And when I came to work here, I thought, oh, that fits with the diverse clinical background that I've got. You know, I found it really rewarding of what I'm doing, because it fits with my clinical experience, one, and two, it gives me the opportunity to improve and to really have a good impact in the health service here as well as the communities. There's
been an enormous growth in services both within Wheatbelt and Northam Health Service. So we've got dialysis on site now, we've got expanded oncology service, we've got a rehab unit, we've got a midwifery-led birthing service, we've got ED-based mental health services. You know, there's all of these new services that have come online since I've been here. And then there's a big expansion of the command centre and all the arms of the command centre. And then there are other services outside of the WACS hospitals, you know, all the stuff in community, and so many moving parts which you know, Wheatbelt patients may need to access. Something I've been quite passionate about is growing that pipeline to the rural generalist, and the RCS has been well established. Now we've got a well established JMO program, and the next step for me was to get registrars, and we did become accredited for advanced skills training in emergency medicine and general medicine here at Northam. That accreditation is with RACGP and with ACRIM. Yeah, so that's really, really exciting because it's all coming together.
Clinically, there's lots of opportunities here to develop, and that is also a good experience that you are part of the team which developing the learning and the development, clinical development aspect of the medical service. But also you have the challenge of being a good leader, so that gives me an opportunity also to develop in a leadership scale and just be part of an effective, dynamic team. Also, there's a teaching experience where you can teach students, junior medical officers. When I started here, there was not much of a junior staff, but now we have a significant number of junior doctors, and we've developed a good teaching program. I was really surprised. There's lots of things that you can enjoy here. So you've got the Avon Valley, you've got lots of activities, community activities happening, which is unique to Northam, like the air balloons. Looking at the place overall, it's a lovely place to live in. It's a small town, but at the same time, you've got all the services, everything that you need to live a decent lifestyle. I had this multiple times before where I recommended for my friend colleagues, doctors, to come and work with us, and when they come here it seems like they want to stay here longer. How much support we have here and the diversity of work that we do, the rewarding experience that we go through, clinical, community, all these dynamics, when they come here actually they appreciate it, and they tend to stick with us longer because the experience that they had, it was a good and rewarding experience.
I love the people in country. I love the close-knit community within the health service. I love the wide open spaces. I love the landscapes. So I've been doing this for 7.5 years, and I plan to do it for the foreseeable future. I love my role here.